Patients, caregivers, and their clinician partners use evidence to inform clinical decision-making. Researchers, who are evidence creators, mostly disseminate evidence through conferences and journals. Yet evidence only becomes habit when patients, caregivers, clinicians, and community organizations find and use that evidence in their daily lives and workflow. How does the general public access information they need to make decisions? What a mind-busting question. Let's narrow it down to dissemination of evidence to the patient, caregiver, activist community, as they are likely to share further. I say fit in where you can get in. Offer information where people have time to absorb that information when they care. Diverse audiences share and take in evidence through varied means. One size never fits all. At most basic, people prefer to read, listen, talk, or watch. Some prefer stories, others data. People have short and longer attention spans. People can be neurodiverse, deaf or hard of hearing, blind. I produce newsletters, podcasts, and videos about questions and concerns people have about the choices they make in their health decisions, where they live, work, play, and learn. I disseminate through social media and direct mail. In this session, I will host conversations about creating cascadingly complex, usable information that can be shared by word of mouth and through social media. Who's the audience? How can we hardwire listening to those audiences? How can we more easily fulfill asks, such as teach, learn, fund, collaborate, and partner? How can participants take one more step in their dissemination and connection journeys? So, start small, very small. Who's your smallest viable audience? What's the minimum number of people you would need to influence to make it worth the effort? What questions might they ask? What do they need or want? Where does your smallest viable audience gather, and how do they take in information? Through aligned organizations, community initiatives, campaigns, events, faith communities, salons, radio, talking heads, podcasts, videos. Hang out there. Hang out where people take in information. If you don't know, find out before you proceed. Picture those people as bobbleheads on your shelf with specific names, roles, cultures, and characteristics. Look at Shuri the Avenger. Maybe that's a tech-savvy caregiver. Scarecrow, a data geek, measure developer. Rosie the Riveter, a union rep, patient, parent. Scully, a practicing clinician investigator. Einstein, person-centered academic. What do you want to accomplish? Listen, learn, catalyze, partner, collaborate, share, teach, raise, spend money? Pick one. What questions do you have? Now craft the message, the story, the ask. What's the hook? How can you attract attention, touch a nerve, or heartstrings? Link to more information. Think thumbnail, tweet, or screen size. Don't know this stuff? Once again, find out before you proceed. Onward.